Hi everyone, welcome back to the new topic on health indicators. I am Mrs. Beulah Dallas, Associate Professor, Community Health Nursing. The objective of this session is the learner will be able to understand the various health indicators. The health indicators are the measurable characteristics of a population which researchers use as supporting evidence for describing the health status through survey and statistics. Health indicators are often used by the governments to guide to make policies related to health or to make goals for improving population health. Let's see the characteristics of the health indicators. The health indicators should be valid. They should actually measure what they are supposed to measure. And the second characteristic is reliable and objectives. That is, the answer should be the same if measured by different people in similar circumstances. And next one is sensitive. That is, they should be sensitive to changes happen in the situations concerned. And next thing is specific. That is, they should reflect changes only in the situations concerned. The next characteristic is feasible. That is, they should have a ability to obtain the data which is needed for making policy or making the objectives. The relevant. They should contribute to the understanding of the phenomena of interest. Let's move on to the classification of health indicators. There are 12 indicators are available. They are mortality indicators, morbidity indicators, disability rates, nutritional status indicators, healthcare delivery indicators, utilization rates. Indicators of social and mental health, environmental indicators, socio-economic indicators, health policy related indicators, indicators of quality of life, and the other indicators. Totally, we have 12 classifications under this health indicators. So let's see about the mortality indicators. Mortality means related to death. So some of the important mortality indicators are given here. That is crude death rate, expectation of life, infant mortality rate, maternal mortality rate, specific death rates related to age and disease, proportionate mortality ratio, case fatality rate. Crude death rate means that is total death happen in a country or in a state. 6.1 death per thousand population, it is the current crude death rate in Tamil Nadu. That is in India 9.1 death per thousand population. Expectation of life in India is 70.42 years. In Tamil Nadu it is 74.90. Expectation of life means a person who's from the birth to till how long a person can live in this world. That is the expectation of life. So infant mortality rate, that is from 1 month to before celebrating the first birthday of the child. If the child has died, we can include an infant mortality rate. The current IMR is 13 per thousand live birth in Tamil Nadu, 28 per thousand live birth in India. Next one is MMR, that is maternal mortality rate. That is the death happened during the pregnancy or during the delivery or within 41 days after the delivery. So this is 54 per lakh in Tamil Nadu, 145 per lakh in India. The specific death rates, it is related to age and diseases. That will be vary according to the disease condition, according to the age group. And the proportionate mortality ratio also will be vary according to the disease conditions. And the case fatality rate, that is also depends upon the disease conditions. The next indicator is morbidity indicators. Morbidity means is related to disease related indicators. The some of the morbidity indicators are incidence rate and prevalence rate, notification rates, attendance rates, admission and discharge rates, hospital stay duration rates. What does incidence and prevalence means? Incidence means it is a new cases diagnosed in a particular period. Prevalence means that is the new and old cases. That's the current status of or the number of the particular cases present in a country or in a state. Next thing is notification rate, that is the number of cases which is notified to the national health authorities during a specified period of time per 1 lakh population. Example, if you want to know the notification rates of a tuberculosis means the number of TB cases, that is including new cases or relapsed TB, it is notified to the national health authorities during the specified period of the time, that is maybe the 6 months or 3 months or a month per 1 lakh population. Next, attendance rates, that is how many people are coming to the OPD to a PHC or community health center or in a taluk or teaching hospitals. And admission and discharge rate, that is how many admissions or discharge happen per day or per month in a hospital. And the hospital stay duration rate, if a person comes to the hospital, how many days they are staying in the hospital for the particular, it's depends upon the disease condition. Okay, whether it is the stays will be prolonged or within a short period they are getting cure and they are going. So that should be the morbidity indicators. The next indicator is disability indicators. So here number of days of a restricted activity, bed disability days, work or school loss days within a specified period, and the expectation of life free of disability. These all the indicators comes under the disability indicators. Maybe due to an accident, the disability may be the temporary or a permanent disability. So these are the things should be measured, that is the number of days a person with a restricted activity due to their disability, and the bed, how many days they were in the bed, that is how many days they are dependent. Okay, that is then how many days they are not going to their workplace or the school, that is the absent days due to this disability. Then the expectation of life free of disability, how many days, within how many days they can free from this disability. Okay, so these are the indicators comes under the disability. The next indicator is nutritional indicators. They are anthropometric measurements, that is height, weight, head circumference and chest circumference, BMI, whatever it is. And the height of the children at school entry, prevalence of low birth weight, clinical surveys for anemia, hypothyroidism, night blindness or other vitamin deficiency disorders. Next, healthcare delivery indicators. Here the doctor population ratio, doctor nurse ratio, population bed ratio, population per health center. These all comes under this healthcare delivery indicators. According to the WHO, there should be one doctor for 1,000 population should be there. But currently in India we have one doctor for 1,511 patients. And the next thing is doctor nurse ratio. It is expected by the WHO is one nurse for 300 patient, but at present we have one nurse for 670 patients. Population bed ratio, at least we need to have 3 bed per 1,000 population, but here we have 0.5 bed per 1,000 population. And the population per health center, that is in PHC 20,000 to 30,000, community health center 80,000 to 1,20,000, sub center 3,000 to 5,000. Next indicator or utilization indicators. That means how much the people are utilizing the healthcare services which is provided by the state and the central governments. So healthcare utilization rates, extents of use of health services, proportion of people in need of service who actually receive it in a given period. The proportion of infants who are fully immunized in the first year of life, that is immunization coverage. Proportion of pregnant women who receive antenatal care, minimum 5 visits during their pregnancy time. Hospital beds occupancy rate, hospital beds turnover ratio. These all comes under utilization indicator. Next, social and mental indicators. These are the indirect measures commonly used for the health. Here we can find out the number of suicides and homicides rates, road traffic accidents, alcohol and drug abuse. That is indirectly measuring the health of a country or a state. Next, environmental indicators. This reflect the quality of environment, measures of pollutions, the proportion of people having access to safe water and sanitation facilities, and vectors density. So these are the things we have to identify, and we can take it as a measurements for a health of a population or a community. Next thing indicator is socio-economic indicator. This we can use it as an interpretation of healthcare indicators. This is also not giving direct effect on the health. Indirectly it is implies on health. The rate of population increase, level of unemployment, literacy rates, especially females, family size, housing condition, example number of persons per room. The health policy indicators are the proportion of GNP spent on health services and health-related activities, proportion of total health resources devoted to primary health care, and allocation of adequate resources to the health centers. The other indicators are indicators of quality of life, basic needs indicators, and the health for all indicators. Till now we have discussed about the various health indicators which is help us to plan the health policy or to formulate the objectives in order to achieve the health for all by 2030. The indicators are mortality indicators, morbidity indicators, disability rates, nutritional status indicators, healthcare delivery indicators, utilization rates, indicators of social and mental health, environmental indicators, socio-economic indicators, health policy indicators, indicators of quality of life. Let me conclude this topic. An indicator is a tool or value which gives an idea, sign or guide. These indicators of health are variable used for the assessment of a community health. The health indicators are measurable, the characteristics of a population which researchers use as supporting evidence for describing the wellness of a community. Thank you for your patient listening.